Let's talk about something that can be really disruptive and honestly pretty worrying. Irregular, heavy, or just plain unpredictable periods. If that sounds familiar, I want you to know you're in the right place. We're going to be talking about abnormal uterine bleeding, a condition that affects millions. In this explainer, we're going to break down what it is, what causes it, and how it's treated, to give you clear information so you can feel more in control of your health.
First things first, if you're going through this, you are so far from alone. Seriously. Studies show that a huge chunk of women of reproductive age, we're talking between 10 and 30%, deal with abnormal uterine bleeding. It's a really common health issue, and just understanding it is the absolute first step toward managing it.
Okay, but what does abnormal actually mean here? The definition is a lot more specific than you might think. So let's break down what doctors are really looking for.
So, abnormal uterine bleeding, or AUB for short, is basically any bleeding that's outside of your usual pattern. Maybe it's way heavier, lasts longer, or comes more often. But here's the really crucial part. It's what's called a diagnosis of exclusion. That just means before a doctor can say for sure that it's AUB, they have to rule out everything else, from pregnancy to other specific medical conditions.
And here it is. This is the single biggest piece of the puzzle. In a staggering 90% of AUB cases, the root cause is something called anovulation. All that means is that an egg isn't being released from the ovary during the menstrual cycle. And without ovulation, the whole hormonal symphony gets out of tune, which can lead to the irregular bleeding. This is the why for most people.
So if anovulation is the story for 90% of cases, what's going on with the other 10%? And for that matter, what causes anovulation in the first place? Well, to answer those questions, doctors need a system, a way to investigate every single possibility, and they use a pretty clever framework to do just that.
That framework is a mnemonic called Palm-Cohen. I know it looks a little complex, maybe like a secret code, but it's actually a brilliant system that's designed to neatly categorize every potential cause of abnormal bleeding.
And the system is split into two really logical groups. The Palm half covers all the structural causes. Think of these as physical issues inside the uterus that a doctor could actually see on an ultrasound or another scan. Then, the Cohen half covers the non-structural causes, which are more about how the body's systems are working, things like hormones or bleeding disorders that you can't just see on a scan.
All right, let's start with Palm, the structural stuff. P is for polyps, which are just small growths on the uterine lining. A is for adenomyosis, which is when that same lining actually grows into the muscle of the uterus. L stands for leiomyomas, which you probably know better as fibroids. And M is for malignancy, which means cancerous or precancerous cells. This is rare, but it's something that always has to be ruled out.
Next up is Cohen, the non-structural causes. C is for coagulopathy, which is just a fancy way of saying there's a problem with how your blood clots. O is for ovulatory dysfunction. That's the anovulation we already said is the #1 cause. E is for endometrial issues, where the problem lies with the uterine lining itself. I is iatrogenic, meaning it's caused by a medical treatment, like certain medications or an IUD. And finally, N is for not yet classified. That's a catch-all category for more rare causes.
So, with this whole list of potential causes, how does a doctor figure out what's actually going on with you? Let's walk through what a typical doctor's visit and the whole diagnostic process usually looks like. The process is really methodical, and it usually follows these 4 steps. It all starts with just a conversation. Then your doctor will likely do a physical exam, run some basic lab tests, and only if it's needed, move on to more detailed things like an ultrasound or a biopsy. It's all about narrowing down the possibilities one step at a time.
That first step, your history, is where you are the absolute star of the show. Your doctor really needs to know all the details, the timing of your bleeding, how heavy it is, and they often measure this by asking how many pads or tampons you're using, and any medications or even supplements you might be taking. This is why keeping a simple diary of your cycle before you go can be incredibly helpful.
Okay, so once your doctor has a clearer picture of what's causing the issue, the focus shifts to treatment. And the good news is there are a lot of really effective options out there. The goal is always to find the one that fits you and your life best.
And here's something that I hope is really reassuring. The vast majority of cases, especially the ones caused by anovulation, can be managed really well with medication. Yes, surgical options exist, but they are almost never the first thing a doctor will suggest.
So here are the most common first-line treatments. A hormonal IUD is great because it delivers progestin right where it needs to go. Combination birth control pills help regulate the entire hormonal cycle. Progestin-only pills specifically work on the uterine lining to control the bleeding. And you know what? Even over-the-counter NSAIDs can help reduce both blood loss and pain.
Okay, so remember how we said medications can cause AUB? Well, here is a fascinating little paradox for you. A hormonal IUD can sometimes cause irregular bleeding when you first get it. That's an iatrogenic cause. But that very same device is also considered one of the most effective long-term treatments for controlling abnormal bleeding that's caused by something else. It's all about how those hormones are being used to manage your specific situation.
Now, when medication isn't quite enough, or for certain structural problems, surgery might become an option. The two main procedures are an endometrial ablation, which removes the lining of the uterus, and a hysterectomy, which removes the entire uterus. It is absolutely essential to know that both of these procedures mean you can no longer become pregnant.
Whew, we have covered a lot of ground, from definitions and causes all the way to diagnosis and treatment. So let's bring it all together and really focus on the most important things to take away from all this.
All right, let's recap the 5 most important things to remember. Number 1, AUB is common and it's treatable. 2, lack of ovulation is the culprit in the vast majority of cases. 3, most of the time medication works really well. 4, seeing a doctor to get a proper diagnosis is the key to finding the right solution. And finally, number 5, remember that you are an active, essential partner in your own healthcare journey.
And that brings us to a final thought. Your body gives you constant feedback, and AUB is one of those signals. It's not something to just put up with or ignore. So we'll leave you with this question to think about. How can really listening to your body's signals and trying to understand them truly empower you to take control of your health?